Alpha Home meets a critical need that is not met by any other organization in our city, which is residential exclusive to women, many of whom have never had any wellness checks. They're able to get wellness checks for women, dental, psychology, physical therapy, and glasses, anything else that they need during their stay to make sure that they're healthy and able to participate. Having the medical students provide care to them not only provides training for the fellows and the residents, but it also gives back to the community.
Working in this clinic dispelled a lot of stereotypes. To be able to hear the story of the women that are here, all the trials that they go through, really be able to see them as people and not as their problems, and see they're just like all of us. They've just been have to deal with some really tough issues. It's important for medical students to provide health care to those who can't access it, because it helps us to see a different side than what we may be used to, whether in our own background growing up or what we may see at medical school. These services really help us to see all aspects of healthcare and allow us to serve and gain compassion for those who historically have not been very well served by the healthcare system. A potential donor could help our clinic a lot, because the services that we provide are wholly dependent on what we're able to obtain.
Providing care to people who can't access it is very important, I think, for medical students, especially early on in our training, because I think that from the start of medical school or nursing school or whoever, we have a lot of students who visit here, we start gaining very practical skills and knowledge that we can actually use to help people. Almost immediately after my first encounter, I realized that substance abuse and substance use disorders, that's only like a small fraction of the medical history of the patients that we see at Alpha Home. The more I started to visit Alpha Home, the more I realized that getting to see the same patients over and over again and actually seeing them improve, see their health improve, and developing a closer relationship with them is very rewarding. We would be incredibly grateful to donors who would be willing to help us keep our shelves stocked and keep our equipment running.
The people that we care for in the Alpha Home Clinic are women who are recovering from substance use and addiction, traumatic events in their childhood, and then addiction may follow, but they all deserve good, compassionate care. Our student-faculty collaborative practices has really survived financially based on the generosity of many donors. The money that we get is just fabulous. It really allows us to do what we do and allows us to grow.